After losing much of 2020 to a devastating pandemic, it's sort of exciting to see the conversation which is now switching from despair to hope. And turning that hope to reality comes with a bunch of questions. How long will it take to vaccinate the bulk of our population? Which vaccines will succeed here in India? How can we beef up the infrastructure? What should be the hierarchy of these vaccine recipients? Must we keep all our production for domestic application? Should we export significant quantities with, a twin humane come commercial objective? How should vaccines be priced? That's very critical. How should we price the vaccine? To pick the best from among this array of competing choices, we need to consider the issues on three fronts, and those are logistical, economic, and of course ethical. Before COVID-19 hit us, India, led the world on every vaccine logistic metric. We produced about 40% of the world's pre-COVID requirement, and 3/4 of that was exported. India also administered the largest immunization program aimed at nearly 56 million children and pregnant mothers every year. However, we've always struggled and not quite ever achieved more than 70% of that target. So now how do we scale up against COVID-19 without compromising the health of our children and pregnant mothers? Let's look at the money. India may need to spend about 60,000 crore rupees to inoculate its most vulnerable citizens. But that's over 85% of the union government's annual health budget. On the flip side, of course, vaccine exports are a very significant chunk of our dollar earnings. By some estimates, that could be over 1 billion doses that are worth over $13 billion. So how can we create an ethical balance between subsidizing our poor and vulnerable while protecting all the work done in vaccine production and exports? Then the question on ethics. Is the COVID-19 vaccine a private good or is it a public good? Should we permit a commercial market for it, or should the state exercise complete control over how the vaccine is going to be distributed? So should some people be allowed to buy the vaccine at a special price? Now, would that trigger corruption and corrosion in society? These are all ethical questions. Now, our health policymakers can borrow a page from their kin's success with Tatkal. Remember Tatkal tickets that are sold by the Indian Railways? Now, they could, like Tatkal tickets are designed, they could design a premium Tatkal scheme that would allow well-off people, well-off citizens of India to sort of, in a sense, jump the queue. And they could then buy the vaccine at an exaggerated price. I want to underline that, at an exaggerated price, not at a normal price, exaggerated price, especially since that purchase would have a collateral advantage. It would allow a full subsidization of the vaccine administration to the truly vulnerable part of our population. Now, here's one way to do it. Let me run some numbers for you. Out of the 100 crore vaccine shots India would administer in 2021, that's next year, what if we reserve 10% or 10 crore shots that would be sold under the Tatkal category now underline this, at 10,000 rupees a piece, 10,000 rupees a shot. Now, these, of course, need not be the vaccine that would be administered to all of India, the subsidized vaccine. These could be the pricier Pfizer or Moderna vaccines, which we could specially import for this purpose. Now, the entire Tatkal scheme can be very transparently administered because we have this very awesome e-governance infrastructure that's already been built up in the country. Now, a little bit more on the numbers. If the full quota of 10 crore vaccines is snapped up by, well-off Indian households eager to protect our family members at 10,000 rupees per shot, if that's snapped up, that would raise 1 lakh crore rupees for the government. That's how much it would raise. 1 lakh crore rupees for the government, and that would effectively allow the state to fully subsidize a fully free vaccine for the rest of the population. So for 10% of the people paying an exaggerated price, the rest 90% can be vaccinated free. Finally, since the government's health budget would not get sucked into the COVID program, into the COVID vaccine program, the existing non-COVID immunization programs would not get starved of funds. Other healthcare initiatives, they would continue unhindered, and over a billion vaccine doses could still be exported, and that would safeguard the export market that our producers have built up painstakingly over the several decades. Now, isn't this a win-win-win solution? If we choose not to do this, I would like you to consider the alternative. What will happen? Thousands of Indian families would travel overseas to get vaccinated, and that would drain our resources. Instead of those resources getting invested in our local economy, they would get drained overseas. And another thing would happen. A flourishing black market would emerge in getting, fake priority medical prescriptions, all fake, but people would pay all kinds of cash to get that done. Or people would try to access stolen vaccines for a high price. And all of that would mean that legal cash, legal money would get transferred to the black market, to the underworld. So, that's clearly a lose-lose-lose outcome, isn't it?